Hello, friends. I'm Dr. Vikas Bhise. I'm Consultant Urologist, Andrologist, and Kidney Transplant Surgeon at Medicover Hospitals, Kharghar. So today I'll be giving a topic. I was doing a topic on kidney transplant. So I'll be talking briefly about kidney transplant. Definitely, it's a vast topic to cover in one video. But I'll try to catch up the most common things that people want to know. So kidney transplant, as such, has been done from long time. But what is kidney transplant, how it's done, and why it is done? That is what I want to talk about today. Kidney transplant, as we all know, we have pair of kidneys. Everybody has pair of kidneys. 2 kidneys everybody has. If by some diabetes or blood pressure, which are the main common disorders with which kidney failure occurs, patient is not able to produce urine and not able to excrete the waste, he has to undergo dialysis, a process called dialysis, in which the blood is circulated to the machine and toxic wastes are excreted. 3 times or 2 times a week, patient has to go for dialysis. Nowadays, we have increased number of patients going on dialysis. So why the transplant is needed? Transplant definitely is needed because once we do a transplant, patient gets free from the dialysis. The morbidity of the dialysis decreases. There are complications of dialysis which are not there with the kidney transplant per se. Plus, patient's time is saved. Patient's life is duration is more compared to patient is on dialysis. So these are the few important things why we look for the transplant. So how it is done? It is done by surgical maneuver. We have 2 types of kidneys which can be available for the patient. One is first degree relative, mother, father, wife, son, daughter, who can donate their 1 kidney to their nearby relative. Why we need nearby relative is because the blood compatibility, the cross matching is better with them, and nowadays the transplant laws are very strict, so we cannot take a distant relative or non-related patient for the live related kidney transplant. Definitely it is called live related kidney transplant. The another one is the deceased donor transplant. What is deceased means? The patient who has undergone a brain death, in the patient is in ICU, patient is on ventilator, on blood pressure support, his kidneys are functioning, heart is functioning. Such a patient who doesn't have active functioning brain, that patient is declared as a brain dead by the brain dead committee of the hospital, and then that patient is allotted in the city for the organ donation. If the consent is given by the patient's relative or patient has already signed prior to the accident or some trauma, then that patient's kidney, liver and other organs can be taken for deceased donor transplant. So these are the 2 ways with which we can do kidney transplant. Definitely there are some complications, implications, the things to go ahead. We have plenty of documentation to be done prior to the transplant. We have transplant meeting, we have uronephromeet, and then we see the patient. We have to diagnose the patient's condition, the donor condition. So there are plenty of factors with which we go ahead and select the patient for the kidney transplant. We do donor evaluation, then recipient evaluation. If both of them are compatible, the blood groups are good and the cross match is good, then we go ahead for the kidney transplant surgery per se. There is definitely something called as swab transplant. If ABO incompatibility is there and still blood antibody titers are on higher side after plasmapheresis, what we do is we swap the donors of both the different blood groups and then we do a transplant. The results are excellent. The time and money is saved for the patient. We need not give unnecessary immunosuppression, more immunosuppression to those kind of patients. We at Medicover have been actively doing kidney transplant program, and most of the transplants are successful here. We have done cadaver transplant here. Patients are excellent. We have done swab transplant and live transplant is going on. So if any kind of information is required regarding kidney transplant and its complication and implication, you definitely can reach me at Medicover Hospital, Kharghar. Thank you.